Hello, my name is Diego Illanes. I'm a urogynecologist with Milford Regional Physician Group, practicing at the Women's Pavilion at Milford Regional Medical Center. Urinary incontinence affects more women than men for multiple reasons. It could be because of the anatomy, it could be because of the risk factors, for example, childbearing or menopause, which are very known causes of incontinence. And if because of the anatomy, the female urethra is anatomically much shorter than the male urethra, and it can be subject to more trauma or weakening of the structures around it. The types of urinary incontinence that affect women are mainly two: stress urinary incontinence, which is the one that is manifested by leaking urine with physical activity, or it could be as simple as coughing, sneezing, or lifting anything. Sometimes even walking or running. The other type is the urge incontinence, described as the leakage of urine or the necessity to run to the bathroom right before the leakage happens. That one is many times associated to urinary frequency, which is having to go too often to the bathroom during the day, but sometimes also during the night, interfering with the sleep. And in women, what causes urinary incontinence is multiple factors, from prior surgery, childbearing, obesity, or smoking, physical activity, even genetics. Sometimes it could be alterations on the patient's own tissue that it can weaken the structures in the pelvic floor, leading to the leakage of urine. The symptoms of urinary incontinence is the involuntary leakage of urine before making it to the toilet. It could happen in drops. It could happen sometimes patients feel they completely have a bladder accident, emptying the whole bladder content. And also it could be associated to frequency during the daytime, or to nocturia, which is having to go too many times during the night, waking the patient up at night. So childbirth leads to urinary incontinence. We believe it's because of trauma to the tissue in the low pelvic structures, in the pelvic floor. But interestingly, it's not the only factor. Sometimes patients will have 1 or 2 or 3 babies without leakage of urine, and sometimes some moms will have only 1 baby, or being pregnant one time, having a cesarean section, and still end up leaking urine. We believe that is probably affected by the pressure of a pregnant uterus over the bladder and also over the pelvic floor, leading to the leakage either during pregnancy, that it may be resolved after having the baby, or may have a long-standing effect of weakening the structures in the pelvic floor, leading to leakage after the baby is born. Menopause causes urinary incontinence because all these muscles and other pelvic connective tissue structures that support the bladder, the urethra, which is the tube where we pee from, where we urinate from, is supported by estrogen that is normally produced by the ovaries before menopause. And by withdrawing estrogen to these structures, it causes a weakness, and we believe that it leads to the lack of support, and thus causing the leakage. So the type of doctor or nurse to go first with urinary incontinence is your primary care provider, either the nurse practitioner or the primary care physician that you see annually for your physical exam is a good start to bring up the problem of going too often to the bathroom to urinate, the problem of waking up at night too often to urinate, or the leakage of urine and having to change too often or to wear pads. More importantly, you have to have the discussion that that's not normal. There is a misconception that is a part of a normal aging, which is not true. And they will know how to guide you through the first steps of how to address this. How is urinary incontinence diagnosed? Patients will make the appointment to come and see us. And the first thing we do, we take a very detailed history, which includes a bladder history. And we focus on addressing the quality of life impact that this problem is causing. After the physical exam, after the history taken, we do a physical exam, and in the physical exam is very similar to what patients undergo when they have their annual pelvic exam. We make the patients cough, for example, to address the movement of the pelvic structures and address if the leakage happens then. That is the first step. We may include some procedures during that initial visit, which may include addressing the bladder function, like measuring with an ultrasound after the bladder is empty, if the empty is occurring completely or not. Also, we can test the urine for infection, and also we can perform procedures like looking inside the bladder and measuring the strength of the muscles of the bladder. How is urinary incontinence treated? Urinary incontinence is treated in different ways, at different levels, and according how much impactful is for the patient's quality of life. It can go as simple as recommending patients to practice Kegel exercises at home, or to modify the lifestyle, targeting risk factors like, for example, weight loss. We know that obesity can exacerbate the symptoms of leakage of urine, so losing weight certainly helps. So it can be so easy as just start a diet low in calories. Diets also are recommended low in bladder irritants, which many times are the only cause of why patients will have some bladder symptoms. Second steps or further is discussed with patients about addressing the musculature in the pelvis, either by recommending Kegel exercises at home or involving physical therapists. We have in this region really good professionals that they focus in pelvic floor health and pelvic floor physical therapists that they can retrain those muscles and make them stronger. We can move further into different other treatment areas like pessaries, which are support structures, support rings that we can actually fit to patients to help the bladder get back into position, and thus decreasing the leakage. Or sometimes we talk about surgery. And these days for pelvic floor surgery, it's overall minimally invasive approaches where patients are rarely admitted to the hospital, and most of them are day surgery operations. What are Kegel exercises? Kegel exercises are retraining the muscles in the pelvic floor, which are a group of very thin muscles that close the pelvis from the bottom, and they are in charge of controlling our urination, our defecation, and overall the strength of the bottom of the pelvis. What step you can take at home to treat urinary incontinence? Certainly modifying some of our lifestyle. So lifestyle modification is an important step. That includes, for those patients who are smoking, quitting smoking is not just important for many other reasons like pulmonary or cardiovascular, but also for the pelvic floor structures. We know that smokers tend to be more chronic coughers, so decreasing the coughing episodes will decrease the pressure over the bladder and then decreasing the episodes of incontinence. Doing a low-calorie diet to lose some weight is very beneficial. Again, not just for many other systems like the cardiovascular system, but also for the pelvic floor structures, and it will improve the symptoms of urinary leakage. What are some things in your diet that can cause or exacerbate the bladder symptoms? We target the bladder modification or a healthy bladder diet, trying to decrease bladder irritants. And bladder irritants are typical found in spicy foods or sugars or carbonated beverages. These days, very important, caffeine. Caffeine is a big bladder irritant. Not so much the caffeine itself, but the volume of caffeine that we tend to consume in the Western society. Black tea sometimes can be an irritant. Some citruses, sometimes it's very interesting, decreasing that morning orange juice can really decrease the episodes of the urinary urgency and the urge incontinence. is controversial because it's in part is healthy, but in part is acidic, and acidic foods can really make the symptoms worse. How soon after starting the Kegel exercises the urinary incontinence will get better? It can take up to 4 to 6 weeks. This is like going to the gym. One gym session will not really do a lot for your biceps muscles. You really need to stick to a routine and practice and be consistent, do it on a daily basis, and you will notice the change in 4 to 6 weeks. Should I drink less water if I have urinary incontinence? Not necessarily you have to decrease the fluid intake or modify it tremendously, but pay attention of how much you're drinking. Sometimes it's hard to believe that we engage in activities and we become so busy that we realize that we may be drinking too much, and if it goes in, it needs to come out, and the bladder finds the ways to manage it. It can create that urinary frequency of having to go too often, and that urinary frequency could be managed by just decreasing the intake up to a healthy level, because we all know that drinking good volumes of water, plain water, is very good. What are the medical treatment for stress incontinence? The major recommendations are exercises. Not just exercises of the pelvic floor, but carrying a healthy lifestyle of daily exercises, including or adding the Kegel exercises, the pelvic floor musculature. Sometimes they're hard to do, they're hard to see or know if you are being efficient or squeezing the right muscles. And those patients, we found out that they really get help by visiting one of our pelvic floor physical therapists to help them recognize, pinpoint where those muscles are, get them trained and get them evaluated to make sure they're squeezing the right muscles, the right groups, and they're doing the right exercise. And then another medical treatment could be the pessary. Pessaries are little devices that it can be introduced into the vagina to support the bladder up, to hold the bladder and prevent the excessive movement of these structures that lead to the stress urinary incontinence. What are some non-surgical treatment for urge incontinence? Mainly is the diet. The diet low in bladder irritants. It's a big plus if one can achieve or get rid of these substances that it can be detrimental. Carbonated beverages and caffeine are very common in our diet. Sugars is very common also. If it can be decreased, the symptoms will improve. And also, doing or practicing healthy bladder habits includes timing the voiding. Also referred as bladder retraining. Bladder retraining meaning retrain your bladder or teach the bladder again how to void and when to void particularly. Sometimes if we let the bladder take over, it can happen that we go every hour. But if we try to space out those voiding episodes to up to 2 to 3, 3 to 4 hours during the day, it will be helpful for the bladder to learn a new routine. I practice at the 4th floor of the Women's Pavilion at Milford Regional Medical Center. I am a board-certified female pelvic and reconstructive surgeon. The short name for that is urogynecologist. We treat a diverse number of conditions here, which includes urinary incontinence, fecal incontinence, and pelvic organ prolapse. So we deal with prior pelvic surgery problems, mesh problems. We treat different other conditions like fistulas, either bladder fistulas or bowel fistulas, and other problems affecting the pelvic floor. Thank you very much for your time watching this presentation. If you have any other questions regarding pelvic floor health, feel free to reach out to us at Milford Regional Medical Center.
Hi, I'm Erin, and this is Amanda. We are both women's health physical therapists here at Milford Regional Medical Center in our Northbridge outpatient clinic. And today we're going to talk to you about how physical therapy can help urinary incontinence.
We're going to take a look at explaining what women's health physical therapy is, what to expect on your evaluation when you come in, and treatment options for urinary incontinence with physical therapy.
Now, women's health physical therapy is a non-surgical, team-based approach with your physician and a skilled physical therapist who's taken additional training in this field of study. It's physical therapy that focuses on dysfunctions in the pelvis and the groin that can contribute to bladder and bowel problems, sexual health dysfunctions, and pain complaints.
What should I expect at my evaluation? You'll get a physical therapist that specializes in women's health and be seen in a private room. We'll review your medical history and then ask you some more questions about your eating, drinking, and bathroom habits. We then do our exam, which includes looking at your posture, your range of motion, your hip and spine strength, as well as your core strength. Then at that point, we may do an internal assessment to assess any strengths, weaknesses, or tightnesses in your pelvic floor. Finally, we review your goals and make a treatment plan with you.
Now, depending on your symptoms and what we find during your evaluation, there are several treatment strategies that we have in our toolbox. These include behavioral strategies, manual or hands-on treatment, modalities, therapeutic exercise, and education. And we'll go more into depth in what each of these consist of in our upcoming slides. But it's important to note that not all of these treatment strategies are appropriate for each patient, and that your treatment plan will be tailored to your specific needs.
So, behavioral strategies, bladder retraining techniques are usually given on your initial eval. We give you urge control techniques and ways to optimize your posture when voiding. A bladder diary is then usually given to you to take home and fill out. This helps us monitor irritants and determine a voiding schedule with you. We may give splitting strategies to help void easier and avoid bearing down.
Now, a modality that we have in our toolbox that's different than any other physical therapy clinic that you might have gone to for, say, back pain or knee pain is biofeedback. And what this is it's a computer-based software that tells us the electrical activity of your pelvic floor. It lets us know if you're able to contract and relax your pelvic floor on command, and if you know how to relax and contract, or even where those muscles are. So here, we're going to show you what our biofeedback looks like. Now, this is our biofeedback machine, and what it is it's got little sticky electrodes. There's nothing that's, you can't feel any zaps or tingling. It's just reading your electrical activity in your pelvic floor. And they're just little stickies that we put on either side of your rectum, so nothing goes internal. But this just allows us to see if you're able to contract and relax your pelvic floor. Since these are internal muscles, it's very hard for patients to know whether or not they're using them correctly or if they know how to use them. And our biofeedback machine just gives them a little visual whether they're doing that correctly or not. And as you tighten your pelvic floor, we have it on the rose mode right now, but the rose will close, and as it relaxes, the rose is going to bloom and open.
Now we're going to talk to you about therapeutic exercises we may give you. We will go over the correct ways to perform a Kegel, as you probably have heard of Kegels before, but we will go over in depth how to perform the Kegel the right way. Stretches that we may give you, it may include some yoga poses. We may also think it's appropriate to try dilators to help further stretch your pelvic floor. And then we'll also give you some hip and core exercises to apply with your Kegels and apply that to your daily activities.
So as physical therapists, we love to educate our patients. A lot of times my patients' heads are spinning when they leave my treatment room, but we always have handouts so you can review at home, so no worry. But some things that we like to specifically talk about in women's health physical therapy is self-management techniques, and these include fluid management strategies, dietary changes, weight management strategies, as well as educating you on your bladder irritants. These are foods and fluids that irritate the lining of your bladder and can make your bladder more excited and actually increase your urinary urgency or even your incontinence. And lastly, a home exercise program. Our goal at PT is always to make our patients independent with managing their symptoms in the future.
I have some of these issues now, what should I do? If you think you would benefit from being seen by a women's health physical therapist, please call your doctor and ask for a referral to a women's health physical therapist. Either we have therapists at 2 of our locations in Northbridge and in Milford.
Thank you for watching our presentation. Again, if you have any of these symptoms or if you feel like we can help in any way, feel free to reach out to any of our clinics and give us a call, or reach out to your physician for referral to Women's Health Physical Therapy.